Hi, I'm Nishita Devkumar. I am 57 years old and I've been a diabetic for since 2014. Initially, because I don't live in India and I work in Oman, so I had two diabetologists like who used to look after me, and there would be a conflict obviously because the medicines there are different and the advice is also a little different, not that different, but every time I came to India and I couldn't do the follow-up and there was a lot of problems till September when I came over here to this clinic. Was referred to me by my aunt who has been a patient, who has been with the doctor for quite some time, and she referred to me and she told me that why don't you meet my doctor, and that's when I came here. At that point of time I wasn't taking insulin, and I had already promised myself that I'll bring my diabetes down. Before that, before I came here, about in 2000 during the COVID time, my BP level shot up to 11, and I was just taking the medicine that was recommended to me by my Indian doctor, and I continued taking that because I had bought a lot of medicines. I took medicines along with me and went, and I started dieting, I started walking, and so from 11 I brought it down to 6, I brought it down to 7, and I came over here like it was 7 point something. So when I met this doctor it was about 7.4, and then the next time I did a test it was about 7.8. That's what he says, it was 7.8. And today my diabetes, it's been like September and this is March, it's come down to 6.4, and according to my doctor now he says it's reversed. It's going on the reversing mode, like you are reversing your diabetes, which he is very happy about. But for me personally, the whole the aspect of taking insulin was something new. He introduced that to me, and initially I didn't want to take it. So he had actually advised me to take it for a week, and then if I was not comfortable with it, that he would stop it. But I continued to take it, and they were monitoring me for 14 days. I was monitored, and there was a very systematic method of treatment that was given. So there was a diet thing that was happening, as well as there was the medicines that I was taking, and the medicines were not many, they were very few. But when I went back to Oman, what I did was, on my own, I joined the gym in November, and by December I joined the boxing classes. So I started boxing, and I used to go boxing twice a week, and I used to go to the gym 3 days a week. So my coach, I got myself a personal trainer, and I told him, I said, see, listen please, I need to reduce my weight, I need to lower my sugar levels, I need this exercise because I am overweight, and I needed that so that I could bring down not just my sugar levels but also my weight, and also have a very healthy life, because I used to be a sports person before I got married. After I got married I just neglected myself, and here this is the story I have. So at a point when I started the exercising and that part of it, I found out that with minimal amount of with the instructions of the diet as well as with the exercise and the boxing, because boxing like it gives you, like you waste around 1500 calories every session. That's 50 minutes of boxing, you lose that much of, you burn that much of calories. So that being the strength, that being a positive thing for me, I took to it very seriously. And when I checked myself, my sugar levels had come down to 84 post fasting and 100 and something post fasting. So I found by myself that it was something that I didn't have to do much. I had to exercise 1 hour a day, and 5 days a week, and I started becoming more healthier. My clothes started becoming more loose, even though the size I am right now is quite big. I'm quite big, but in this process from August to now, I have lost about 12 kilos of weight, without putting that much of effort. So the only thing I do is 2 meals, that is the breakfast and the dinner, I try to have it without salt. That's the only thing in the diet. Otherwise, I tend to eat everything, but very moderately, very moderately. And I am happy with the result, because I am scared whenever I stand on that scale, or the usual thing that we have, that oh my god, when I take my sugar readings it's going to be high. But when I take my sugar readings and I see that okay fine, it's not as high, and I take my sugar readings once a week. So I keep a track of it. I stand on the scale once in 15 days, or maybe once in 3 weeks, so that it's not like okay, today I put on 500 grams, tomorrow I lost 200 grams. Instead of doing that, I'm very practical in just taking it in once in 15 days, or once in 3 weeks. And that kind of gives me a very positive, it gives me goals, so that I can say okay fine, this is what I want to do. I'm not looking at losing like 40 kilos in 1 month. I'm actually looking at losing maybe 1.5 kilos in a month, or let's say 1.5 kilos in 1.5 months. So that is workable, it's doable, and in my case it has helped me. So I'm pretty happy with the treatment I've got over here. And also the people around over here have been really very helpful, and they've made a thing like diabetes look like it's workable, you can reverse it. In my case it is on the verge of being reversed, and I plan to see that I reduce the weight, I continue what I am doing and bring it down. Like I need to get over it, it's not something that I will not get over it. I'll definitely get over it. So I'm very happy with this clinic, Thank you, doctor, and thank you everybody else for helping me through this journey of mine. Thanks a lot.